Why is ADEM more common in children than adults? Imagine your immune system as a vigilant guard that protects you from infections. In children, this guard is still learning and can sometimes overreact, especially after infections or vaccinations. That overreaction is what leads to acute disseminated encephalomyelitis, or ADEM, being more common in children than in adults. ADEM is an inflammatory condition where the immune system mistakenly attacks the protective covering of nerve fibers in the brain and spinal cord, called myelin. This usually happens after a viral infection or, less often, after a vaccination. Children's immune systems are still developing, and this makes them more prone to such exaggerated responses. Their immune cells tend to react more vigorously to infections, which can sometimes trigger an autoimmune attack on the nervous system. Adults, on the other hand, have more mature and regulated immune responses, which lowers their risk of developing ADEM. Another reason is that children experience infections more frequently than adults, especially viral infections like measles, mumps, or influenza. These infections can act as triggers for ADEM. The immune system responds to the infection, but in some cases, it gets confused and starts attacking the nervous system instead. This process usually takes a few days to weeks after the infection, which is why symptoms often appear after a child has recovered from an illness. In children, ADEM typically appears as a single episode with sudden symptoms such as fever, headache, confusion, and neurological problems like weakness or vision changes. It is usually a one-time event, called monophasic, meaning it doesn't recur. Adults with ADEM may have a similar presentation but often face worse outcomes and may experience different disease patterns. It's also important to understand how ADEM differs from multiple sclerosis, which is another demyelinating disease. Multiple sclerosis is more common in adults and tends to involve multiple episodes over time, often without the fever or encephalopathy seen in ADEM. Multiple sclerosis is a chronic condition that can cause ongoing neurological problems, whereas ADEM is usually a one-time, acute event. Epidemiological data shows that ADEM mostly affects children between 5 and 8 years old, with boys being slightly more affected than girls. The incidence is about 4 cases per 100,000 children each year, with more cases occurring during winter and spring, coinciding with common viral infections. Understanding why ADEM is more common in children helps doctors distinguish it from other conditions like multiple sclerosis. While both involve damage to myelin, their triggers, course, and outcomes are different. Recognizing these differences ensures children receive the right diagnosis and treatment. In summary, the higher rate of ADEM in children is mainly because their immune systems are still maturing and tend to respond more aggressively to infections and vaccinations. This heightened immune response can sometimes lead to an autoimmune attack on the nervous system, causing ADEM. Knowing this helps healthcare providers differentiate ADEM from other demyelinating diseases and provides appropriate care. If you or your child experience neurological symptoms after an infection or vaccination, it's essential to consult a healthcare professional for proper evaluation and management.